So as we know that there are a lot of myths and misconceptions prevalent in the society in regard to asthma. So let's delve into these misconceptions without wasting a time. So to begin with, asthma is a chronic disease which has two components. One is airway inflammation and the other is bronchoconstriction. So to understand asthma, we need to know about the basic causes of asthma. So asthma basically is a genetic disease which can run in families and it can be transmitted from one generation to other generation. Having said that, it's not always that every child will develop asthma. So it's something called trigger, which will cascade these symptoms of asthma. Now, what are the common symptoms of asthma? Anybody suffering from asthma may have either one or combination of the four symptoms: cough, chest tightness, shortness of breath, and wheezing. So these are the four cardinal symptoms of asthma which may be present either singly or in combination. So why it is important to know asthma? So because there are a lot of myths and misconceptions in the society regard to asthma. Like asthma is an incurable disease. Asthma requires a treatment which has a lot of side effects like inhalers. People think that inhalers are the last resort and they can cause a lot of side effects. So we are today here to discuss about all those myths and stigma and to remove those myths and misconceptions from one's mind. So it's not always a childhood disease. Although in majority of the cases, asthma may start in the childhood and may progress, and the child who is having asthma may outgrow with asthma and may have symptoms starting in a very early period of life. But in around 1/3 of the cases, the child may completely get cured on its own. Or you may say that asthma symptoms may completely disappear. I should not have used the term cure because asthma is a chronic disease, as we discussed in the beginning, that there is no cure to asthma. It can only be controlled. So using the term cure may be a misnomer. So the better term to use in case of asthma is that asthma can be well controlled. So majority of the children or majority of the patient start the symptoms of asthma in childhood and may completely disappear to reappear later in the adult life or in the adolescent life. But there are certain cases where the children might outgrow with asthma, might continue to have symptoms of asthma. So that is the reason we must know that there is an inflammation which is going on, and we emphasize specifically today on this forum, I emphasize that all the patients, whosoever is a case suspected to have asthma, either a child or an adult, must immediately go to the doctor, and the doctor should do a simple test called spirometry or a pulmonary function test to diagnose asthma and put the patient on treatment at the earliest, which is inhaled medication or inhaler, so as to reduce the burden of the symptoms, improve the quality of life, reduce the amount of absenteeism from the school or work, and reduce the risk of future complications due to exacerbation and other risks involved with asthma.